Hi, my name is Christine Valley, and this is for Lesson 5, Informative Speech. My topic is physician-assisted suicide. My specific purpose is to inform people what physician-assisted suicide is, that physicians are in favor, and what purposes it serves. My thesis is PAS is supported by physicians and is a personal decision, and legalizing it gives the patient the right to die with dignity. Ever hear of the Hippocratic Oath? Well, what that is physicians swear to respect and are expected to follow in practice. It basically describes how physicians should practice, how patients should be treated ethically and responsibly, and adhere to preventing disease. Never does this oath state that taking away a life under no circumstances. Life is to be valued, preserved under the care of a physician, and gives the physician ultimate responsibility to treat those who are ill, sick, and dying. PAS is a personal decision, and legalizing it gives the patient the right to die with dignity, to end pain and suffering. My father was recently diagnosed with stage 4 lung cancer. Although his pain is under control, I would absolutely support the decision if he decided that he was going to use the option of PAS, and if it was legalized here, I would support him. If he had no turnaround, if the pain was not under control, and ultimately, if he made that decision, I would be there for him. Why should he suffer if the inevitable is going to happen? Giving those who have debilitating disease is a gift to them. The choice allows the person who is affected and will die from this disease or condition to remain dignified and have some control of their lives. A debilitating disease can affect anyone at any moment. None of us think about dying until the moment we know that we might be dying. All of us live our lives like there's a tomorrow. I would ask anyone to consider somebody with a debilitating disease. Would you want some control? Wouldn't you want to die with dignity? However, that is defined by oneself. I'm going to describe what physician-assisted suicide is. It is a physician who assists the terminally ill in terminating their lives, but under certain circumstances and based on the patient's diagnosis. Dr. Barry Rosenfield, an associate professor of psychology from Fordham University, provides guidance and assistance such as a prescription for lethal medication, along with instructions on how to use the substance. The patient must follow the doctor's orders and administer the substance themselves. The patients do administer themselves, not the doctor. Ho Yin Ao, who grew up in Hong Kong and moved to the States, attends MIT. Both of his parents passed away from cancer. In the modern era, he goes on to state, interest in PAS has intensified. This is far from surprising, since people in industrialized countries live much longer on average than they did 100 years ago. Advanced medical technologies can prolong the lives of the terminally ill, sometimes sacrificing quality for quantity of life. PAS is not an option for the depression card or to commit suicide for any other reason than terminal illness, which is a debilitating disease that will eventually lead to death. With the help of physicians and under the direction of the patient, patients can end their lives prior to the point of becoming completely debilitated. Knowing, for instance, that somebody has stage 4 cancer and how the disease will progress is painful in itself. It breaks down every system of your body. To have control prior to that can bring some relief to the dying patient. According to a study published in 2009, Lee, Price, Rayner, Hatoff aim was to determine if physicians were in fact in favor of PAS, which is physician-assisted suicide. They conducted a survey with doctors in England and Wales and found that there was in fact an agreement among PAS. There was a 39% agreement and a 49% opposed. Physicians do understand that there is an importance to die from a terminal illness with little to no pain as possible. I'm going to refer to a graph that was published from the Oregon Human Services, and it goes on to state that both the number of patients receiving prescription drugs for use in assisted death and the number of assisted deaths under Oregon death have both increased. If you look here in the blue, it shows the patients receiving prescriptions have increased from 1998 to 2007. It also goes on to state that the number of deaths have also increased from 1998 to 2007. Okay, so this is the graph, and this was published by the Oregon Department of Human Services. Okay. PAS is not an option for the depression card or to commit suicide for any other reason. By giving the patient a choice when to end their lives can give the patient control. Patients are dignified, at ease, and eventually will die in no pain and will have a more dignified death. Patients will not be humiliated and while their disease is progressing. A lot of people feel that they need to have some control over what they're doing in the end, and this absolutely gives that patient the right. PAS is not granted as easily as one may think. There are guidelines the physician must follow. For instance, there are operating procedures, and for example, I'm going to mention the Netherlands. Schwinland goes on to describe that an application is placed by the patient who will suffer unbearably without getting any better. According to Schwinland, an article, a study of the first year of end-of-life clinic for physician-assisted death in Netherlands, goes on to describe the legal care criteria for PAS dying in the Netherlands. Their guidelines are: 1. The attending physician must come to the conviction that the request from the patient is voluntarily considered. 2. The attending physician has to come to the conviction that the suffering of the patient is unbearable and without improvement. 3. The physician has informed the patient about his or her situation and prospects. 4. There are no more reasonable alternatives for the patient. 5. The physician has concluded with at least one other independent physician. This is important. Also, last one, 6, the physician has terminated the patient's life or provided assistance with suicide with due medical care and attention. Lee et al. Describes how, in addition, a patient's mental capacity must be evaluated, autonomous and consistent with the values of the individual, without absence of a disorder of the mind or brain which could influence the decision-making process. All these requirements must be met and are important when a physician is deciding if a patient will be eligible for PAS. Although the Hippocratic Oath is sacred to all physicians and stands for physicians to be ethically, legally, and medically competent throughout their practice, many physicians understand the importance of providing a painful death, one in which would be supported under strict guidelines and policies. PAS is not taken lightly, and carefully thought out series of decisions that both the patient and the physician must come to terms with. Both ultimately decide. Patients are under the direction of the doctor who prescribed one lethal dose of the medication to end the patient's life peacefully without a long, drawn-out, painful death. Giving patients a choice gives them some control over their lives. Wouldn't you want to do that for somebody you know? Physician-assisted suicide follows guidelines in the Netherlands, and if it is implemented elsewhere, and will be implemented elsewhere, the guidelines must be specific for each country or region or wherever it's being implemented, but this is important. Decisions shouldn't just be left up to the physician. There needs to be guidelines in place. Although the Hippocratic Oath does not state to take a life away, physicians do understand the importance of a painful death. It would only be supported under these guidelines. It is not taken lightly and needs to be a decision that both the patient and the physician agree upon. It should be supported only in terminal illness where pain and suffering would be unbearable and there is no other turnaround. To die from pain and suffering would give families, those caring for the family, and the patient themselves some relief in the dying process. When one thinks of PAS, think of the patient and how this can assist in ending one's life painfully and in peace. Proof is in the surveys and literature that PAS is supported and within the medical community. With the rise of death and with the rise of requests of physician-assisted suicide, this is an important topic and must be considered within the medical community. I think with education, understanding among physicians and other medical staff, it can be implemented as long as there is a universal understanding of who, what, when, and where, and how it can be implemented. PAS is, yes, a physician assisting a patient to commit suicide, but ending one's life peacefully with dignity and respect, along with giving the patient a final say in how they end their lives.